The Canadian Medical Association says it's time for the country to have an honest conversation about private and public health care. Megan Fitzpatrick looks at a new report from the group representing Canada's doctors that's making recommendations to improve the country's struggling healthcare system.
The Canadian Medical Association says Canada's healthcare system is in crisis. There are still long wait times for patients. ERs are often full. Millions of Canadians don't have a family doctor. And the CMA says the status quo is not working and changes are needed. In a new report, they note that governments are increasingly turning to the private sector to deliver publicly funded health care. Ontario, for example, is paying private clinics to do cataract surgeries. Prince Edward Island is using a private company to deliver virtual health care to its residents. And given this trend of using the private sector more and more, the CMA says it's time to talk about the mix of public and private healthcare delivery in this country. In a new report, it outlines various principles it says should underpin the health system, including transparency and accountability, and it makes 22 recommendations to address various healthcare challenges.
We should be able to recommend that if we are going to incorporate privately delivered services that are funded by the public system or funded privately, what are our guardrails? How do we ensure patients are getting the quality that they need?
A key recommendation is calling on governments to fund more healthcare teams. The teams could include not just a family doctor, but also maybe a nurse practitioner, a mental health professional, a dietitian, all paid for publicly. Dr. Danielle Martin is part of a family health team in Toronto. She says this model will not only give more access to primary care for millions of Canadians, but give them the right kind of care that they need. For example, someone with back pain, they need a physiotherapist, not a family doctor.
Having a physiotherapist working in a publicly funded team covered by your public health care plan can make a huge difference, and that can also extend the capacity of family doctors and nurse practitioners to take on more patients.
The CMA says 50% of Canadians should have access to a family health team within the next 5 years. Its other recommendations cover a range of topics. Bottom line, the CMA is saying if governments are going to change the existing mix and balance of public and private health care in this country, those policy changes should be based on solid evidence, and they should ensure that patients are getting more access, not less, to quality health care. Megan Fitzpatrick, CBC News, Toronto.